As you all join us, give us a few moments to make sure that all families have been able to log in, and then we will start in a couple of minutes. Welcome, everyone. Give us a few more moments to make sure that all families have been able to log on. While you are waiting, we have shared some housekeeping items here on the screen. Hello, everybody. My name is Reggie Gackett, and I want to welcome you to our fourth webinar in our Spring 2021 Family Webinar Series. I am the Assistant Director in the First Year Center, and tonight I'm joined by my colleagues, Dr. Tom Brounk, Director of Mental Health Services within Habif Health and Wellness Center, and Missy Showalter, Care Manager for Habif Health and Wellness Center. We are excited that you've chosen to join us for tonight's conversation. Some information before we get started. First, we want to make sure that you know how to submit questions during this webinar. You will notice that we have given you the ability to ask questions via the Q&A feature. Two of our professional staff within the First Year Center are helping to field these questions. We will answer those we find applicable to the audience as a whole on this webinar, and we'll respond to more nuanced or personal questions via email next week. Let's go ahead and make sure you know how to use the Q&A feature. Use the Q&A feature on the bottom of the screen to share the place you're watching from, and we'll share some of these places on air live. While you do that, we will be showing a PowerPoint created by Mental Health Services during tonight's webinar. However, if you prefer to download this PowerPoint and follow along on your own, please follow the link just shared in the chat. As a note, in the chat feature, we will be sharing links and email addresses throughout the duration of the webinar. Third, this webinar is being recorded live. Later this week, we will upload this webinar to the families.woostel.edu website. Lastly, in a moment, we will hear from Dr. Brounk and Missy about the mental health services provided by their team. If something they say sparks a question, don't forget to send us your question via the Q&A feature. After hearing from our panelists, we will move into the question and answer portion of the evening. Before passing things along to Dr. Brounk and Missy, I want to share some of the places people are joining us from. We have families tuning in from Chicago, Illinois, Los Angeles, California, and Boston, Massachusetts, among many others. Now, since I know you all want to hear more about our mental health resources, I will turn it over to our panelists.
Okay, good evening, everyone, or late afternoon, wherever you might be. My name is Dr. Tom Brounk. I'm Director of Mental Health Services at Washington University here in St. Louis. And joining me today is Missy Showalter. We're going to take you through about a 7 or 8 minute, just brief Mental Health Services 101. Just to get us started, I thought it'd be helpful to share a little bit about our team. We have about 22 professionals on staff here. On the left hand of the screen is our psychiatry staff, including our mental health nurse who supports the staff. In the center, the upper center, is the leadership team. And below that is our care manager and our mental health service coordinator, Krishan Newton. She is really the face of mental health services here at Habif. So most likely, if you were ever to call, she would be the point person that you'd be speaking with. And then on the right-hand side of the graphic is our counseling service team. So they are the ones providing all the direct counseling care to your student.
So welcome again. My name is Missy. I'm the care manager. I actually went to grad school at WashU, so go Bears, and now I work here. So a little bit about the services offered. And again, our health center is Habif Health and Wellness. So at our center, we provide counseling services. We call them short term, so kind of brief interventions for students. We do couples counseling work, so that could be kind of two friends, two roommates, or someone in a romantic relationship with another partner. We also have group services available as well. In terms of our counseling services, you get 9 free individual therapy sessions per academic year. We also have access to psychiatry, which is mentioned there. Psychiatry is never free, unfortunately. It goes through insurance, so your cost depends on your copay. We are open Monday through Thursday, 8 to 5, and then Fridays, 9 to 5. A student can schedule their first appointment by going online to our portal, which is great for those that don't love calling on the phone. We also have more urgent appointments. So if a student is really having a tough time, they can kind of come in and kind of Zoom with someone, same day availability.
Okay, and then I just wanted to briefly mention the Let's Talk program. Let's Talk was actually introduced at Cornell University over a decade ago, and is at probably by now hundreds of university counseling centers across the country. This is really an outreach program. It tries to place our staff out into the WashU community, now via Telemental Health. And basically it can serve as a very sort of low intensity, low stress way of meeting a member of the staff. Students don't have to schedule an appointment. They don't have to fill out any consent forms. It's really a way to try to decrease some of the stigma and decrease some of the challenges with, getting up the courage to make an appointment. So oftentimes the student will just sort of drop in, and then depending on how the conversation goes, we either are able to provide some support to them and they get their needs met, or this can be a bridge back to the Habif Health and Wellness Center.
So another option of services that we offer is a therapy-assisted online program, lovingly shortened to TAO. This program we've had for a few years. It is an online platform that is very robust, so a student can enroll by themselves, and they have modules on anxiety, depression, stress management, maybe communication, relationship type stress, and also substance use. And so it's a really cool way if a student doesn't even walk through our doors or kind of log in, that they can go online and do a self-starter. And so really do some modules. I've done them myself. The videos are actually really engaging. And so that's a nice place to start if a student kind of is, maybe out of Missouri or just wants to get started on their computer tonight from wherever they are.
So very briefly, wanted to talk about some options for group treatment, which during this time of isolation and social distancing, being able to bring students together, even though that is through a virtual platform, can still really help to address some of those feelings of disconnection, aloneness, and isolation. So we are actually seeing an increase in the utilization of our group options. Some of these are available to a student regardless of whether they're in the state of Missouri or out of the state of Missouri. Our Doing Better Today series, DBT for short, is actually, I think we have 3 sessions of that now running. So it's a very popular group. There's also groups for different populations on campus. RISE being for our African American students, Lavender Circle being for our LGBTQ plus community, and then also our ACT workshop, which is really helping to teach different skills to students, to try to manage what they're feeling, what they're thinking, just some good sort of stress relieving types of tips there.
So, one of my favorite resources, and I tell many students when I meet with them, is a free is kind of the big, bold word. So, we have a free after hours support line, and this is for any of our students, undergrad, grad, it doesn't matter. And so, this is whenever our health centers close, the student can call this number, and we have licensed staff that are on the other end that just work with our students. And so, a student can call, maybe they're needing some coping skills, maybe they're having some panic or anxiety, or maybe they just want someone to help make a plan for how the evening goes. It's a really great spot. It also can be for a crisis too, but it doesn't have to be. So I encourage students, if you don't know who to call in the middle of the night and you don't want to wake someone up at 3 a.m., these providers are awake, which is wonderful. And there's no limit on number of times you can use it. So it's a really cool thing we've added. And we really encourage many students to try it and just see how it goes. The next thing that we're talking about, we have a really robust connection to the St. Louis community. Part of my role as care manager is to really network with providers here and to make good connections between what students are looking for and the services that we offer in the community. So, one of the things we've created is a counseling center referral service website. It's kind of like a database per providers where a student can input what they're looking to work on and maybe their insurance, and a specialized list of people that we've vetted kind of pulls up. So it's a really cool way of when a student doesn't know where to start, they can kind of start online and even look at profiles before they make any calls or take any next steps. So we're really proud of this. There's about 60 providers that are in it right now, and we're constantly expanding to kind of match what students are looking for in terms of diversity of providers, specialty of providers, and all of the above. So that is something that students can use at any time, and we're updating it kind of on a regular basis as well.
And I just wanted to briefly bring to everyone's attention that besides Habif is an integrated health and wellness center. So it's not only mental health services, it's health services, and it's also health promotion services. So I did not want to really provide this information without also talking about the importance of prevention. So I would encourage all of you to after this webinar is over, is to just check out all of the resources that are available directly on our website. Just helpful tips, things that you can easily recommend to your student if they're having difficulty with sleep. Just put out the healthy sleep strategy tip sheet. Send it to them, put a link. It's all very good information that our staff have really reviewed and put together in a very sort of attractive format. So please check that out. And then lastly, I just wanted to clarify, I know that this is a question that oftentimes parents have, is during this time of COVID, just what is available to students depending on whether they are here in St. Louis or within the state of Missouri or outside the state. So as you can see, almost quite a few of the different slides that we just finished discussing, those services are available to students regardless of their location. The mental health checkups actually refer to brief phone conversations that we can have with students to help support them in finding treatment at home, or offering some very sort of brief tips, some skills that could be taught. Really, the services that we cannot provide at this point in time would be anything that involves the delivery of treatment provided by a member of the professional staff. So even though TAO is actually online treatment, we can provide that because it's got a heavily educational component to it. So it comes close to the kinds of things that we would be talking about with students, but it's just that face-to-face service, both by psychiatry and our counseling professionals, that we could talk about it later, but there are some really important reasons why that service is limited at this point in time. I think that's the end of our slides, Reggie.
Thank you, Dr. Brounk and Missy, for sharing that information. As you know, there are WashU students currently studying and living remotely. Can you speak a little bit more about which resources are confidential for students and which ones are not?
So I can take that. Really, in order to do the work that we do here at Habif, it's really important that students know that unless it's a situation that's one of significant risk of harm to themselves or to others, everything that we talk about, is held in the strictest of confidence. That doesn't mean that we aren't open and wanting to partner with our parents and our families. All that we would really need is for the student to sign a release that allows us to have that communication. And as long as that's there, we really welcome and value that opportunity to work with parents. There might be important information that you can share, and we also might have suggestions about how you can be helpful.
Thank you. We will now move on to the remainder of our question and answer portion of this webinar. As a reminder, please submit your questions via the Q&A feature below. A first question that we have is, in order to follow COVID mitigation strategies, students in quarantine and isolation housing are isolated and unable to leave their rooms. How is the university helping these students to maintain their mental health?
I can start with that one if that's okay, Reggie.
Oh, Missy, it seems like you may have disconnected
How about
just
now?
briefly. Okay, we can hear you again. Thank you.
Good. Yes, this Zoom is very challenging. So not only is it challenging to be on a microphone, but it's also challenging to be in isolation and also be worried about your own health. So we have a number of things. So the first is we have that after hours line, but we actually have it 24/7 for students that are in isolation. So there's a flyer in each room, and also kind of our medical staff that interacts with them will kind of share that. Our medical staff also checks in when they do kind of their daily check-ins about how are you feeling, how is your mental health, what do you benefit from talking to someone. So we've actually gotten some referrals that way so that we can kind of check in with them and kind of just say, hey, how's it going? What can we do to help? And the other thing is we're thinking about forming some type of support group for kind of those students that are together so that maybe they can at least have the community of, other people virtually kind of going through the same thing. So a lot of that's in the works right now, but they can talk 24/7 to our Provident line, and that's kind of where we kind of send them as a first round.
Are there certain resources in place for students with diagnosed eating disorders?
There are, and fortunately we have licensed professionals on staff who are trained to treat eating concerns in our students. Lindsay Herzog is our therapist that really leads that effort, but it is a group of professionals that works together to best support these students that are struggling with eating concerns. So a member of our medical team, Dr. Jennifer Hillman, we have a dietitian that is part of that team. We have several therapists, a psychiatrist, and a nurse that will all coordinate with one another, and communicate with one another so that if the student is appropriate for services here at Habif, we can coordinate that care and hopefully what feels like a seamless way.
Mhm. I would just add to that, Dr. Brounk, that if a student maybe needs a little bit more support so that the outpatient level isn't kind of appropriate, I would team up with the student or whoever and really help say, what are the programs that are around? What is your insurance? How can we help you get to the best level of care? So know that even if we're not kind of at Habif the right level, we do make sure the student feels supported in seamlessly transitioning to the spot that kind of would be most beneficial for them.
Yeah, and we are, thank you, Missy, and we're very fortunate to have here in St. Louis, really very close by, but also virtually, a couple centers that one of them being really nationally known for their treatment of anxiety and depression, and including eating concerns, that Missy actually keeps a very close communication with, and can help facilitate direct referral.
To change gears a little bit, I know that you all had referenced this during your presentation, but we have a number of folks asking, what is the process for students who want to sign up for counseling services, and how long does it take for students to have their first appointment?
I'll give this one a go. So we've done a lot to make the process more seamless and go faster because we know that when motivation hits to make a change, we want to really optimize and really get in there. So when a student wants to kind of get started, they would go online and web book via their portal. It's called an initial consultation. So we have same day appointments available and kind of next day for these 30-minute kind of first interactions with the therapist. That the therapist might say, kind of what's going on? How can I be helpful? And really get that started. So the contact is really brief at first, but really meaningful. So even maybe having some coping skills in the first session, and then the therapist will help direct them. So if they're appropriate for our services, get them back on their calendar, within a week or two. And so we really are trying to make sure that when a student wants it and they're appropriate, that we get them in pretty quickly. Dr. Brounk, what do you have to add to that? Is there anything I missed?
No, I think you really covered it. We find that having to call on and speak to somebody on the phone can sometimes be an impediment to getting started. So we actually transitioned to the portal to help reduce some of that. And so far, it's working, I think, as best as it can, given that we're rolling this out at such a challenging time.
Could you speak to what resources are provided by professionally trained staff members and which are student run? I do know a family member shares that they do know we have a peer-led counseling service on campus. Is that correct?
That is. It's called Uncle Joe's. It's been around, I think, since the late 60s. In fact, I think that we probably WashU can claim some fame here, and then I think it's the longest running peer-led support, counseling support in the country. We have a member of the staff that works very closely with Uncle Joe's to provide them support. If they are ever faced with a student situation in which they feel like it would be helpful to get some additional intervention, they want to check that what they're doing is correct. We have staff that are available here, as well as through that Provident line that can intervene, that can jump in when needed, when necessary. But that can also be, Uncle Joe's can be a really nice sort of backdoor, so to speak, into the counseling center. A student that can talk about the support here, can help to normalize it, and make that connection with the student. So the work of Uncle Joe's, they try to keep that confidential as much as possible. Obviously, if they have a concern that arises that's out of their comfort level, they're going to seek the support and the consultation with the counseling center. Did I hit that question, or was there another part to it?
Yeah, to follow up, which of the other resources provided are done by a professionally trained staff member in comparison?
Yeah, so aside from Uncle Joe's and aside from Sarah, which is our sexual assault response action hotline, or anonymous hotline, I forget what the A stands, second A. But those are the two really front-facing student support services. We have several that are educational in nature. But besides that, really all of the mental health services provided on campus are going to be coming from Habif.
We have a family member asking, how does your team perform outreach for those students reluctant to reach out for help?
Should I take that one?
Yeah,
Missy?
and I'll jump in. Go ahead.
Okay. All right. So you may recollect I talked about that Let's Talk program. That was actually one of the main goals of Let's Talk was to help reduce the barriers to seeking services. You might think of it sort of like a, like an advising session with a professor. That would be the equivalent. A student is coming in for some informal conversation. They're usually only about 15 or 20 minutes in length. A lot of that depends on if there's a wait. If there's a wait, we're going to need to limit the time. Otherwise, sometimes it can be, if you luck out and there's nobody behind you, you could get close to a full meeting in, depending on the needs of the student. So the other important thing to Let's Talk is that we do try to focus, our placement on campus when we're not virtual, so that we are located in places that are underserved populations on campus, those who have a history of being targeted, through history, so that we're putting those individuals in places like the Office of International Students and Scholars. We're putting them to our Office of Diversity and Inclusion. Places that students perhaps that may need some additional, that just historically may not be, counseling may not be a service that would come up for them as a place to go and solve their concerns or their issues.
I would just add, Dr. Brounk, that's great. I would add that we have at Habif what's called peer health educators, PHEs. We love acronyms here. And so our PHEs actually are students, current students who are trained in the mental health resources, and they have events. Right now they're virtual. So they put on an event that I helped with called Connecting in the Time of COVID. They have these kind of events that are a nice, not counseling or kind of one-on-one interactions, but more, let's have a session where I see my peers and we're talking about mental health and it's kind of a safe environment. So I would say, start very small, really a tiny bite first and then kind of work up. So I would say those peers are a really great influence on our students, and research shows that students are most likely to turn to a peer first rather than come straight to a counselor. So we really like to use them, and we have a great team this year that's a part of that. So.
We recognize that many students, especially our first year students, have been struggling to find connection in this majority virtual environment and are feeling pretty isolated. What recommendations do you have for students in order to help them prioritize their mental health in a group setting?
So I'm sure we'll both have something to add there, Dr. Brounk, but I can start. So the first thing is we know that some of our usual coping skills have gone out the window. And so really trying to be creative about how we can do small things that really make a difference. So the first one is kind of fresh air and being outside. And so we tell our students, especially now that it's getting a little bit warmer, see if they can take a walk, see if they can get outside, get some fresh air and get some movement, because physical health really impacts our mental health. So that's kind of one thing that we recommend a lot, exercise. The other thing is, if you're not Zoomed out, really trying to have Zoom connections with people. So maybe even if you're so busy, having it doing kind of, I'm doing my laundry. Do you want to Zoom and do our laundry at the same time so that we can have conversation and you're not kind of trying to force one more thing on the schedule. So working smarter, not harder, trying to do that. So kind of those are two, trying to eat healthy if you can. So really, I know that it is so hard right now to balance everything, but really kind of good nutrition will help kind of boost our mood as well. Dr. Brounk, other ideas that we have that we give to our students about finding connection and prioritizing their mental health?
Yeah, so I think the whole idea of knowing what brings you energy, something that brings you energy in, is all about sort of keeping that, what I call that emotional bank account, keeping it from getting overdrawn, so to speak, because it's when it gets overdrawn that some of the problems start occurring. So, it's different things for different people. And you might know, your son or daughter probably better than anyone. So sometimes just reminding them, hey, I know that you really like doing crosswords, or you really like doing jigsaw puzzles, or practicing with when's the last time you picked up your guitar, an instrument? You know, it, it can be many different things, coloring, for some people. And really any activity that takes some concentration, but doesn't sort of drain the individual, like writing a paper or having to really read sort of a dense, really dense novel. Something that sort of strikes that nice balance between it. It'll focus, but not, and then keep you engaged and give you sort of a distraction away from, the drain of the schoolwork, but also is easy, accessible. And then I would just also sometimes, you can get into the Zoom, where you're sitting for like 4 or 5 hours, right? You sort of just get into this time warp. And so sometimes this is where your phone can actually be pretty helpful. If you just have it send you reminders, every hour. Did you get up and take a stretch? Did you walk around or go up and down the stairs? We've all got our own stair stepper, at our homes. If you have steps, run something where you have to go up and down on the floors. But it's that kind of stuff.
So I know you mentioned mental health services provides group therapy options for students, but are there other low intensity support or conversation groups for students struggling with specific challenges?
Low intensity. So I guess it sort of depends on what so it depends on sort of the needs of the student. Some of them are, being able to join something like a Let's Talk. I seem to be talking about a lot about that today, but I think that, trying to come up with easy things, that are accessible. It can be just putting a warm, sort of like heating up a warm towel and giving yourself your own sort of like warm facial. It can be buying one of those sort of back rubbers that back. Actually, there's these. I just saw it advertised. It's a massage shawl.
Mm.
That you can drape around your shoulders, that's weighted. It's better than sort of, it's less expensive than having to buy a massage chair, obviously, but massage shawl. So that would be low intensity. But I don't know if there are any thoughts that you have, Missy, about this was more about sort of conversations, right?
I would just add, yeah, I love that. I hadn't heard of the Shaw before, Dr. Brounk, but I'm going to have to look into those. I would just add any kind of things. I think our RAs and our Res Life team, so if we're thinking about first years, those they have programs that they offer, virtual programs, things that they can really kind of connect with other peers and their RAs. And I would say RAs, the resident assistants, are really knowledgeable about resources as well. So say your student shows up to one of your RA's events, virtually or not, and maybe they're not doing so well. And maybe your RA could check in and say, hey, I see you're not doing so well. What's going on? And maybe that could be a nice bridge to, hey, did you want to talk to someone? Habif has, these services. So I would say just trying to stay connected, where they live, if that's possible too, kind of any programs that their kind of residential college might offer. I know they have robust programming. And so I would just kind of say start there too and see how that goes.
And that sparked one last thing. The backdoor approach. There's another way of using that. If you're concerned that your son or daughter really could benefit from talking to a counselor, but they're not ready to sort of take that step. What I call the backdoor approach here would be, maybe they're having problems with sleeping, or they're having problems with muscle tension, maybe making a suggestion to speak to one of our MDs, or they're not eating so well, they could get some tips from our dietitian. These are all professionals that could have more influence, and suggest a counseling type of relationship. As long as we know ahead of time that is sort of what the need is, give us a call, and we can, I can make sure to put, send that provider a message before the appointment.
Are there any fees attached to Habif's counseling services?
Great question, Reggie. So I will answer that first. So for our counseling services, like I mentioned before, each student gets 9 free sessions per academic year. So 9 is the number to keep in mind. Session 10 to session 16, you have a copay, the student will. And so basically it goes through insurance at session 10. So it'll differ based on what plan you have. If you have the student plan, it's only $10, so it's really affordable. So I would just say 9 free sessions. Sometimes telling your student, just try this out, it's free, is a nice motivator, just kind of a test run, so to speak, to get used to it while there's no fee attached. Psychiatry, like I mentioned before, I wish it was free, but it's not. It is costing. It goes through insurance from session 1 beyond. So no free psychiatry sessions, unfortunately.
Are all of the counseling services currently, while we're in the midst of this pandemic, are they all currently virtual, or are there in-person options available should students prefer that?
Yeah, that's a good question. So for purposes of the health and safety of everyone, we are providing all routine appointments, anything that would not be, even our emergency appointments right now. We've discovered that we can handle quite a bit of crises that arise, but we do always have somebody at the Habif Health and Wellness Center that's a mental health professional in case a student were to arrive at our door and need something, urgent that could not be handled through a phone call or through a Zoom appointment. So we don't want to be turning a student away. So we will, in most cases, if we can provide, once they're here, if we can provide the appointment via Zoom in one of our Zoom rooms, that's probably what we're going to do. Trying to talk through a mask for an extended period of time is going to get uncomfortable, especially in a inside indoor environment. So that there are reasons why we're doing what we're doing, but if necessary, and we could not do the assessment through any other means, we would do what we need to do an in-person visit.
We have a family member asking that they know that their student is close with faculty members on campus or advisors or staff. Are faculty members or staff members able to contact mental health services if they're concerned about a student? How does that work?
Yeah, great question. So I'll take that one. If a student is really close to an advisor or a faculty member, that's great. So having that touch point is really a good place to start. We've had students who are maybe Zooming with an advisor, and the advisor notices, hey, this student's really struggling. Let's call Habif together. And so we've gotten calls with both of them on the phone, and maybe the advisor starts out and says, yeah, I was meeting with so and they're really struggling, and here's what they shared, so that maybe the student doesn't have to start from the very beginning. So that's kind of a nice warm handoff type approach. And so the other thing is we have a different service called WashU Cares, where if someone's concerned about a student and maybe they just want to kind of like have someone have eyes on the student, a parent, an advisor, anyone can make a report that way. But I would say as long as, the student is open, like having that support, calling together. When we were in person, sometimes we'd have people walk. Maybe their professor would walk them over, drive them over. So we really do like to partner and do that. But yes, they can absolutely help make a referral. It's better if the student's with them and on board.
Can students on a spring term leave of absence avail themselves of WashU mental health services, or should the student be currently enrolled to be able to access?
Yeah, so the short answer is it depends. If the student has taken the medical leave for the current semester and they have paid the health and wellness fee already for that semester, then they would remain eligible for our services through the end of the current semester. If the student took the leave for the spring and let's say they initiated that process at the end of the fall semester, so in that case, they would not have paid the current health and wellness fee for the spring semester, then those students would not be eligible to continue services here. I say that with a caveat. We are going to do everything we can to support a student during medical leave. So if they need assistance with finding that counselor either at home or if they happen to remain here in St. Louis, we will continue to do all that we can to help them find affordable, and professional care during that leave. And that's certainly another part of Missy Showalter as our care manager, her job.
Yeah, Tom, and that's a great point. So I've worked with a lot of students who are leaving and going on medical leave. And so I've helped with psychiatry, kind of connecting to therapy. Maybe it's even something more intense, so an intensive outpatient program. So just know that if a student's leaving, we still have support for them and we want to make sure that they are getting the treatment that they need. So we will do whatever we can. And whether it's at Habif or somewhere else, there is someone that can kind of help make sure they connect.
Could you all speak to what specific services Habif has to offer to support students who hold marginalized identities here at WashU?
Sure, I can take that one. Um, so, well, I think I gave some good illustrations right at the very beginning when I was talking about our group program. We have made well, one there's the RISE program that I mentioned at the very onset. Our Lavender Circle would be another example of providing services where those groups of students can come together and connect with one another and seek additional kinds of support, peer support. As I mentioned already, the Let's Talk program, trying to get out and about on campus in ways that are less formal, more likely that students would be hanging out in these locations on campus. And then we also are very intentional about our hiring practices and wanting to diversify the staff, because we know that having representation on staff is more likely to bring students in when they see faces that are similar to their own. And that will help to reduce some of the barriers there. Missy, I don't know if you had anything else to offer.
Yeah, great points, Tom. I was just going to add, so the other thing to mention is if a student wants to work with a counselor and maybe the counselor has a specific identity that maybe they can't get to see someone at Habif. So my goal about our counseling center referral service is to really make sure that we have counselors who are diverse in racial identity, sexual identity, kind of all different facets, so that when a student says, here's what I really want and here's who I would connect with, a provider of color, someone who does this, someone who can help me with an open relationship. We really try to make sure that we have an option for them there. Another part of my job is I help students who are maybe first gen, lower income, who are eligible for a specific fund. So I help students access money from the university to help pay for some of their mental health treatment. So in terms of marginalized identities, we really make sure of if we don't offer it, we will help you try to find it. And also if you can't pay for it, let's see if we can find a way to make sure that you can access. So I think number one, equity is in accessing these services. So That's what I would say. And we're still learning, and we still have a long ways to go, but I think we're doing a pretty good job so far.
Related, we had a couple of family members ask a scenario where their student's friend recommends a particular counselor to them. Are students allowed to request specific counselors?
Yes, they can. The good part is they can. So we love that, actually. So when a student calls and they say, "Oh, I want to meet with Ari Baker," for instance, we would say, "Yes, here's what she does, and but her weight right now, she might have a little bit of a wait." So then we would tell the student, "Well, do you want to wait for Ari, or would you rather take a sooner appointment with this clinician who's really skilled as well, and here are their specialties?" So we like to give options. We like to empower students, but also give them the information of, do you want to wait for Ari, or like have someone else for now that's they might equally love too if they give them a chance. So we say yes, come in with your requests, and we'll tell you what you can do with them.
We are going to ask one last question for the evening. Family members, as a reminder, any questions we were not able to answer during this webinar will be addressed via email directly to the person who posed the question. Panelists, thank you so much for the information you've shared tonight. Dr. Brounk, what last advice, or Dr. Brounk and Missy, what last advice do you have for families as they help their students navigate the challenges that this pandemic has caused?
What a question. I would just say that parents, you're incredible. It is so wonderful that you are supporting and encouraging and really providing this opportunity for your students. So number one, give yourself some credit. Number two, really realize that they are doing the best they can. And so really thinking about, how can you take care of yourself, maybe focusing less on, really, performance per se, and more about how are they taking care of themselves? How are they, really making sure that they can thrive, in this environment? And so I would just say, focus on wellness first, which is kind of not what you hear from some professors. But without the wellness, kind of the academics might crumble too. So I would just say wellness, and thank you for all that you do for your students, even if they don't thank you.
Yeah, right. That's great, Missy. So I'll go back to one of the sort of fundamental basics here. I think it can be really challenging to listen well, when you are taking the time to listen. And I can't underscore more the gift that you're giving, when you are able to really make the time and listen well and show your understanding by more than just saying, "I understand," but by giving back to your student what you're hearing them say, and validating the frustration or whatever the feeling is that's being expressed, and maybe not always having to have the solution. Because I think sometimes when we get into fix-it mode, that can actually sort of minimize whatever it is that your student is wanting to talk about or express. So maybe giving yourself the freedom to not always have to fix it, and just validate, express your understanding, and listen well. And I think you're going to be doing much more than perhaps you realize.
Dr. Brounk, Missy, thank you so much again. Families, we hope you were able to learn some valuable information this evening. As a reminder, this webinar recording will be shared at families.woostel.edu next week. Additionally, stay tuned for our next webinar, a conversation about academic support, occurring on April 1st. You will be able to register for this webinar at families.woostel.edu. We'll see you then.